I give you 5 minutes explaining people why we are here. You tell them it takes place.
Tongue out.
So, thank you very much. I can't go.
The medical superintendent of Kawolo is there. I saw the chairperson LC1 in one of our meetings. Now he has decided to sit back.
They're telling us that
prevalence buli obutundutundu
make sure that the music you're supposed to the welcoming songs are ready with Cobra sounds.
40 million.
And if you have presentations, I urge you to bring all of them here.
National Housing and National Housing Census year 2024. It want prevalence at 3.6. naye era nga bwe gamba okubalira mu percentage kyangu olaba ng'ekitono naye abantu abalwadde oba abalina disability eyo bangi Uganda naye mu Uganda bw'otunuulira ba doctors abakola
Abasawo
bakigaloyo abafunye obulwadde batono okulaba
Kawolo Hospital,
dokita omu
Abasawo from the we want all of you to apply. We have summit. We shall continue.
Nanze musawo Kiwummulo Milka nga nkola wano ku ddwaliro ery'e Kawolo General Hospital mu Buyikwe District. Era nga ndi wamu n'ekitongole ekya Association of ENT Clinical Officers ne ba Otolaryngology Society of Uganda tuzze okujjukira olunaku lw'abakiggala mu ggwanga lyonna. Olwaleero tuli wano mu ddwaliro ery'e Kawolo nga tugaba obujjanjabi obw'obwereere nga tujjukira olunaku luno olw'abakiggala mu ggwanga lyonna. Tugaba obujjanjabi ku bantu bonna abalina obulemu ku matu, abalina ebizibu mu nnyindo ne Mimiro. Obuzibu bw'amatu ensangi zino abantu baffe tebafunye nnyo knowledge ku nsonga lwaki ensonga zino zibatuukako naddala matu. Abalwadde bano tebafunye enough sensitization oba awareness ku ndwadde zino ez'amatu. Okugera nga endwadde zino ekisinga zireeta ssenyiga. Ennaku zino abaana bangi bafunye ssenyiga naddala masomero. Jjukira nga obulwadde bwa ssenyiga butambulira mu mpewo. Abaana bano bateeka ebintu ebitasaanidde mu matu gaabwe. Ensonga endala abantu bano mu communities eyo tebamanyi wakulaga nga bafunye obulemu ku matu, mu nnyindo oba emimiro. Abasawo batono nnyo ddala eyo abakwatagana ku nsonga zino ez'amatu, ennyindo n'emimiro. Era twongera okuwoola gavumenti etunule mu nsonga zino abasawo bano babateere ddala okuva mu health center paka mu hospitals.
In fact, this child and the child was operated after 5 years.
Kwata embira busatu endikasayo bubiri tikayina mutawaana obuntu obwo mukubira abantu abo mu ngalo.
Workers are exposed to loud noise. You know that Uganda is one of the places with so many industries. So workers are exposed to loud noise without protection. And older people whose hearing difficulties isolate them from family and social life. So it's important that as a district, as stakeholders, we ensure prevention and early detection for us to ensure that there is timely management of hearing issues. I want to pledge as a district team that we are committed to the following priorities. First of all, we are committed to strengthening community awareness and education. And I want to thank Azaituni and the whole community team that is doing this already. So we will intensify outreaches about avoidable causes of hearing loss. We shall ensure that untreated ear infections are responded to. We shall ensure that unsafe traditional ear practices are also fought. Prolonged exposure to loud noise and complications from vaccine-preventable diseases such as measles and meningitis are some of the things that we shall deal with in our outreaches. So full uptake of routine immunization protects children from illnesses that cause permanent hearing loss. So we urge every parent to ensure that their children are fully immunized, and also these parents should ensure to attend routine antenatal care for them to be assisted.
Things we should advocate for as soon as we step in parliament is to eddwaliro lino likuza from this level to a regional referral hospital. Tukimanyi bulungi nti once it's elevated to a regional referral hospital, so many services, so many facilities and so many issues will be addressed. So twagala tukwatagane Afande RDC President Sebo Kao, we are at your service at the shelves without implementing them. So if we see that there is dire need for staffing at all levels, then we should implement it. It's better to prevent than to cure. Because tubatugane nti n'okujjanjaba abaana bano abamu beetagisa kutunda bibanja byabwe okugula just one hearing machine. So if we can prevent this, then that will be the best. So twagala okubakakasa nti tugenda kukikolako. These policies are possible, we can discuss them, and then those structures will be implemented as suggested.